Today we're going to talk about a common yet often overlooked condition that affects many people's nails, onychomycosis, also known as fungal nail infection. We'll walk through what it is, what symptoms to look out for, how it's diagnosed, and the available management options. Whether you're dealing with this yourself or looking to support someone who is, you'll find helpful information here. Onychomycosis is a fungal infection of the nails. It's surprisingly common, affecting about 10% of the general population, and even more so among older adults. It can involve the toenails or fingernails, but it's far more frequent in the toenails. This condition often starts subtly, but can become bothersome, both cosmetically and functionally over time. Let's start with the symptoms. The most noticeable sign of onychomycosis is a change in the nail's appearance. Usually the nail may become discolored, turning white, yellow, or even brownish. It might also appear thickened, brittle, or crumbly at the edges. Over time, the nail can lift away from the nail bed, a process called onycholysis, leaving a space where debris can accumulate, further worsening the problem. Sometimes the nail may develop a distorted shape or become painful, especially when pressure is applied or if the infection spreads. Although onychomycosis is usually not dangerous, it can be a source of embarrassment and discomfort. Some people feel self-conscious about the appearance of their nails, particularly in social or professional settings. In severe cases, especially in older adults or people with diabetes or other circulation issues, the infection can lead to secondary bacterial infections or complications that may need more intensive treatment. The most common culprit is a group of fungi known as dermatophytes, which thrive in warm, moist environments like locker rooms, communal showers, or swimming pools. They can invade the nail through small cracks or breaks in the nail or surrounding skin. Yeasts like Candida and non-dermatophyte molds can also cause nail infections, though they're less common. Risk factors include having sweaty feet, wearing tight-fitting shoes, a history of athlete's foot, or trauma to the nail. People with diabetes, a weakened immune system, or poor circulation are also more susceptible. And unfortunately, age plays a role. Our nails grow slower and become more brittle as we get older, making it easier for fungi to invade. Now, let's talk about diagnosis. If you suspect a fungal nail infection, it's important to get it properly diagnosed rather than just assuming it's onychomycosis. That's because other conditions like psoriasis, eczema, or even trauma can mimic the appearance of fungal nail infections. Your doctor usually will start with a physical examination of the affected nail. They'll look for signs like discoloration, thickening, or separation from the nail bed. However, since appearances can be misleading, your doctor may collect a sample of the nail by scraping some debris from under the nail or clipping a small piece of the nail itself. The sample is then sent to a laboratory for testing. The most common tests include a potassium hydroxide or KOH preparation, which allows the lab to look for fungal elements under a microscope. Another test is fungal culture, which involves growing the fungus on a special medium to identify the exact type of fungus. More advanced tests like PCR can detect fungal DNA, but these are less commonly used in routine practice. Getting the right diagnosis is important because treatment depends on confirming the infection. For example, if the nail changes are actually caused by psoriasis or trauma rather than a fungus, antifungal treatments won't help and might even cause unnecessary side effects. Once the diagnosis of onychomycosis is confirmed, the next step is management. The good news is that several effective treatments are available, but it's important to set realistic expectations. Fungal nail infections can be stubborn, and even with treatment, they often take months to fully clear, as the nail has to grow out healthy again. Let's start with topical treatments. These include medicated nail lacquers like cyclopyrox or efinaconazole, which are applied directly to the nail surface. Topical treatments work best for mild to moderate infections that haven't penetrated deep into the nail bed. They are generally safe with minimal side effects, but they require diligent application, sometimes daily or weekly for up to a year. For more severe or extensive infections, oral antifungal medications may be needed. The most commonly prescribed are terbinafine and itraconazole. These medications circulate through the bloodstream and reach the nail bed, helping to clear the infection from the inside out. Terbinafine is often taken once daily for 6 to 12 weeks for toenails, while itraconazole may be given in pulses, such as 1 week per month over 3 or 4 months. It's important to note that oral antifungal medications can interact with other drugs and may affect the liver, so your doctor might recommend blood tests before and during treatment to ensure safety. Always inform your healthcare provider about any other medications you're taking. Sometimes, a combination of topical and oral treatments is recommended, especially in stubborn cases. In very severe cases where the nail is extensively damaged or painful, surgical or chemical removal of the nail may be considered, though this is usually a last resort. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, in addition to medications, there are some self-care measures you can take to help manage onychomycosis and prevent recurrence. Keeping your feet clean and dry is essential. Change socks regularly and wear breathable shoes. Avoid walking barefoot in communal areas like locker rooms and pools. If you have athlete's foot, treat it promptly, as it can spread to the nails. Trim your nails straight across and keep them short. If your nails are thickened, a healthcare provider might suggest filing them down carefully to reduce pressure and help topical treatments penetrate better. Disinfect nail clippers and other tools after each use to avoid reinfection. Now, let's talk about prevention. Onychomycosis can be persistent and sometimes comes back even after successful treatment. To reduce your risk of recurrence, practice good foot hygiene, wear moisture-wicking socks, and choose shoes that fit well and allow ventilation. Consider using antifungal powders or sprays if you're prone to sweaty feet or have a history of athlete's foot. If you're visiting nail salons, make sure they follow proper sterilization procedures to avoid picking up infections from shared equipment. While onychomycosis might seem like a minor problem, it can significantly impact your quality of life. It's always a good idea to consult your healthcare provider if you notice any changes in your nails that don't resolve on their own. With proper diagnosis and treatment, most people can manage or even clear the infection, although patience is key because the nails grow slowly. So in summary, onychomycosis is a common fungal infection that can cause thickened, discolored, and sometimes painful nails. It's diagnosed by examining the nail and confirming the fungus through lab tests. Management options include topical treatments for mild cases and oral antifungal medications for more severe infections. Good foot hygiene and preventative measures can help keep your nails healthy and reduce the risk of recurrence. Thank you for watching. As always, take care of yourself and make the most of your day.